Hello everyone, it is October. Every year from the 1st to the 31st of October, globally, we raise awareness on breast cancer. So in this edition on Body Gist, we shall be looking at the causes of breast cancer and of course, how we know somebody has breast cancer and the prevention of breast cancer. I am Sister Ozo Augusta. I am a sister of St. Louis. I am also a nurse and a midwife. If you are just joining us, I say welcome to you. And to those of you returning to Body Gist, you are the real VIPs. Thank you so much for always following us on Body Gist. Ensure you watch this video to the very end because it promises to be very, very interesting. See, I have a pink ribbon striped to my dress here. Pink ribbons are used to raise awareness on breast cancer. For us to understand how breast cancer occurs or how cancer occurs generally in the body, let us look at the structures that the body is made of. In biology, simple biology tells us that cells are the basic unit of life, and when cells come together and function together, they form tissues. When tissues function together also, they form organs such as my hands, such as the eyes, such as the tongue, or even the breast. Then when organs function together, they form systems such as the reproductive system or the digestive system. Then when systems function together, they form the individual, which is the body. They form me and they form you. Now, cancer actually affect the cells of the body. And cancer is just abnormal growth of the cells of the body. With the abnormal growth of these cells, they grow out of proportion and cause death around the tissues and organs where they are occurring. According to the National Cancer Research Institute, there are 20 million new cases of cancer that are recorded yearly. And out of these 20 million, about 9.7 million causes death among persons. Now, for breast cancer, there are about 670 new cases of breast cancer occurring yearly. And breast cancer occurs both in men and women, but women have the higher percentage. It is about 99% in women and only about 0.5 to 1% in men. Now, let us look at some of the causes or risk factor to an individual coming down with breast cancer. The first thing we have said that if you are a woman, you have the every likelihood of coming down with breast cancer. Another most likelihood or another risk factor is age. With an increase in age as one gets older, there are so many cells that are destroyed in the body. And if there are buildup of these cells destroyed in the body that have been damaged in the body, that is genetic mutation, it can cause or it can lead to breast cancer. Another factor we need to look at is lifestyle. One of those lifestyle is persons who consume a lot of alcohol. This predisposes the individual to having so much of damaged cells and of course tissues that are damaged that can predispose the individual to breast cancer. Another is cigarette smoking or tobacco use. We know that cigarette smoking and tobacco use contain tobaccos contain carcinogens, that is the things that causes cancer, and this can predispose an individual to breast cancer. The fourth factor I want us to look at is obesity. Persons who have an increased weight. Obesity, for an individual to have obesity, means that the person will have more than needed adipose tissue in the body, and adipose tissue can lead to increased production of the hormone estrogen, and with the production of the hormone estrogen predispose the woman to coming down with breast cancer. Another predisposing factor is family history. Individuals who have family history of cancer in their family or even history of breast cancer are much likely to come down with breast cancer because of passage of these genetic materials from parents to their offspring. Another factor we need to look at is also history of exposure to radiation. This can also predispose individuals to coming down with breast cancer. Another factor we need to also look at are young girls who were exposed to menstruation earlier in life. That is, ladies who attained menarche early in life. This follows the fact that with attainment of menarche early in life, it means that this young lady would have been exposed to estrogen earlier in life, and the more the estrogen in the body, the more exposure to estrogen, because estrogen helps in the development of breast cells, so it can make these breast cells actually grow out of proportion. So this can predispose the person to coming down with breast cancer. Also, women who attain menopause late, say at the age of 55, it means that they will have more exposure to the hormone estrogen. All this can predispose the woman or the individual to coming down with breast cancer. And lastly, with women who are using hormone therapy to treat their postmenopausal syndrome, because in postmenopausal syndrome, one of the treatments is to give hormone therapy, such as giving estrogen to the woman. So the woman may be be giving too much of estrogen, which can predispose the woman to coming down with breast cancer. So what are the signs and symptoms of breast cancer? First, I say 3S: the size of the breast, the shape of the breast, and of course the skin around the breast. Then one should also look at the nipple. Is there change in the size of the nipple? Is there pain around the nipple? Then one of the most characteristic signs is lump in the breast and thickening of the tissues around the breast or tissues in the breast. Then there could also be discharge from the breast. It could be bloody, it could be foul smell. All this would help one to know, or one to go for further diagnostic tests to either confirm or rule out breast cancer. But I would say that it is not all lump in the breast that leads to breast cancer. Some of those lumps are actually benign. That means that they are not malignant, leading to cancers in the breast. What is the prevention of breast cancer? The first thing I tell people is, if you are a chain smoker, please quit, because smoking introduces carcinogens into the body that can lead or predispose an individual to breast cancer. Secondly, alcohol does no good to the body, so please stay away from alcohol. Quit alcohol, because this can predispose you to coming down with breast cancer. And of course, if you're overweight, if you're obese, try to get a weight reduction. This would limit your chances or the risk of you coming down with breast cancer. One very important thing you need to know is a regular breast self-examination. You can do it on your own. You can learn how to do it. Moreover, I've made a video on how to conduct a breast examination. So visit the channel Body Gist to get to learn how to do it. You can do a breast self-examination if you are a woman who has not attained menopause. You can do it 3 to 5 days after your monthly period. At this time, the hormones in the body are at their reduced level, so it will help all those tissues that are thickened to be relaxed. So you'll be able to detect a normal lump a normal tissue in the breast from a breast lump. And if you're a woman who has attained menopause, you can do your breast examination once every month, because you are no longer menstruating, so you do it once every month. Preferably choose a particular day in the month, say the first of every month, so that you always remember to do it. But it is important that you do a self breast examination. And if you have also attained the age of 50 to 55, you can go for mammogram. You do the mammogram 3 to 5 years. It's not advised that you do it regularly. You do it every 3 to 5 years. It will help to detect the tiniest or the littlest lumps in the breast. So this can help an individual prevent breast cancer. Yes, another important thing we need to know is breast sucking. I have made a video on how breast sucking helps women reduce breast cancer. I have said that it is not the breast sucking that occurs between couples. No, this is the sucking of the mother, of the baby rather. So this is breastfeeding. Breastfeeding is what helps to reduce breast cancer. And this is why, as midwives or as nurses, we advise women, allow your baby to suck your breast for as long as 2 years, because this helps to reduce the amount of estrogen at the point when the baby is sucking the breast, during the time you are breastfeeding the baby. For those number of months or years you are breastfeeding your baby, estrogen hormone is produced at the minutest level in the body, so it keeps estrogen away. Remember, estrogen is the one that helps in the development of breast cells, so it keeps this estrogen away, and it helps you to stay away from breast cancer. So mothers, breastfeed your baby for as long as you can. This will help you stay free or prevent breast cancer. We have said and ensure that you do a regular breast examination. We have also highlighted things that can predispose you to breast cancer. If you know that you have a family history of breast cancer, please do not stay away from your physician. Visit the clinic regularly. Do a breast examination, and also do the other tests that could help either confirm or rule out a breast cancer. I am still Sister Ozo August, and remember, this is October. It is pinkish October. Keep following us on Body Gist. Let's keep giving you healthy gist.